us to this conference in Guyana. Good evening or good afternoon from wherever you are. And for us, it is actually a lovely evening here in April. So nice and sunny. So it is a pleasure to be here along with my colleague, Dr. Svirydzenka, to actually present this paper on participatory models for research for community mental health. This came about, obviously we are not from Guyana. Over the last, we live in sunny Leicester in the middle of the UK. We were working on a medical research council funded research application, grant application for UK academics to work with academics in Guyana and also NGOs and medical practitioners like Dr. Sharma, inclusive, and many others as well. So we were planning this application over a period of about 3 to 4 months, and I think we had intense discussions over a period of 4 months. I remember going from October to January, where we used to actually chat every week in the evening. And I think that gave us an idea about the ins and outs of the mental health and well-being and mental health disorders in Guyana. So we are not an expert in the Guyanese mental health context, but we are academics who have an interest in the mental health systems in Guyana, and would like to work with academics in Guyana and also practitioners in Guyana and also with the health authorities in Guyana to improve the mental health system. So that's where we are actually coming from. And the presentation is mainly in relation to how we framed up the whole idea of participatory mental health for improving community mental health systems in Guyana. So our presentation overview, we will broadly kind of cover current mental health context in Guyana, and we will look at the cultural and community perspectives for a systems approach that should be working from the grassroots level in terms of involving the communities, the various range of communities in urban, rural, and other areas as well. And we're looking at also participatory research model and some of the examples. We want to try and bring in some of the examples from our own research in India with marginalized communities and also with mental health literacy, and how this might actually work within the Guyanese context, and also how this might actually work from an international collaboration perspective from any other countries. And we also have some concluding thoughts into how this could be taken up further. So the current context in terms of in the Guyanese context, Dr. Sharma has actually explained in detail in relation to some of the mental health conditions and some of the issues, and also the previous speakers also have outlined some of the key policy narratives as well. But Guyana, from the context of mental illness and mental health and well-being, it used to be a country that actually had the highest number of suicides, and now is actually rated the third country in the world with the highest number of suicides. And I think the evidence actually show that about 10 to 15% of the Guyanese people experience mental illness. And I think, again, this very much depends upon the kind of studies that are actually conducted in Guyana and how representative they are in relation to the various communities, etc. And we also know the COVID over the last year or so, the COVID-19 pandemic that has engulfed all of us around the world, and that has also triggered some of the issues in relation to mental illness in Guyana from the various communities as well, in terms of help seeking and the kind of help that is actually offered to them. So we kind of framed our research idea on these two pillars, really, in terms of the prevalence, in terms of the systems that are actually available, and in terms of the kind of current context that's actually shaping the well-being of the community. So addressing this need, we actually felt that in Guyana, there is currently a fragmented system of mental health services, and it needs actually a systematic a change in relation to participatory models, because all parts of the community, all parts of the country, all parts of the society should be able to actually feed into what kind of a mental health service system should we be having. And that is the essence and the principle and the philosophy in which we actually work. So there are good practices around, a number of good practices, and also our own colleagues from the UK, Dr. Anne Mitchell and others have actually also outlined some of the studies in relation to resilience and mental health in Guyana. So, but I think, however, there are severe inequalities experienced by a number of communities around. And the stigma is endemic, and also there are economic disparities between the different cultural communities. And also in various localities, both in urban, rural, and also in the indigenous context. So with that in view, we wanted to actually kind of look at very much of an inclusive cultural approach. Why a cultural approach? Because obviously, from the global north perspective, we may not actually aligned to the idea of a cultural mental health model very much. And the global mental health initiatives also don't actually marry very much with the cultural approach. Why culture? Because culture shapes the way we think. And if culture shapes the way we think, then I think it also influences our behavior, our attitudes, our thoughts, and the way we actually conduct ourselves, and the way we actually seek services, and the way we even report about mental illness, and also about mental health issues as well. So hence, I think even if we need a holistic mental health systems approach, it should actually incorporate the culture in which the individual is actually living in, the social, political, interpersonal, and the familial context as well. So I think it's important that we try and actually explore that. What is appropriate, because from the service perspective, the services may actually be quite absorbed into a global north agenda. But I think from a cultural perspective, what is acceptable, what is appropriate, and what is accessible for individuals? Those are the three complete components that I think we should be looking at it. We are talking it from that because the three issues. We also look at from the different diverse ethnic communities and how they actually access mental health services in the United Kingdom. So with that in view, I think we need to look at the availability and acceptability of mental health services, what is actually available, what is actually accessible, and the types of help that people are actually seeking, and how are they actually coping with those things, and how are they managing those kind of contexts, and what kind of social support actually currently exists, what kind of family support actually currently exists, and also the kind of understanding the attitudes of individuals. I think that is crucial. That is crucial if you were to actually have a systemic change in terms of how we shape up the future of mental health services in Guyana. So in that kind of context, bringing in the kind of methodology and the philosophical models of research, without actually going into detail about research methodology here, we wanted to look at the health systems model, and one of the best and evidenced health system model is the one by Brentford Berner's ecological model, which has been around for the last 30 or 40 years. Many researchers have actually looked at the various interconnecting systems and how that might actually shape up the mental health and wider health systems as well. So the issue here is actually in terms of how the global North service system influence is actually looks at a one-size-fits-all approach. And the same kind of services, the same pharmaceutical pharmacological approaches, the same therapeutic approaches, the so-called hospital approaches, etc. That might be, that is what is actually being proposed in many of the areas. But is it actually acceptable for the communities in Guyana? Is it accessible for the communities in Guyana? And is it something that they would actually like to see? Actually, what is it that they would like to see actually happen? I think that's what we should be looking at, and not alienating and limiting their kind of involvement. And mental health generally is actually in the current context of the so-called global mental health perspective. The way we look at mental health from the global north perspective is very much based on a deficit model of actually symptoms and interventions and solutions, not necessarily looking at what are the strengths of those people. There are strengths and there are resilience models and the ways in which people actually operate within those systems. So without actually reducing people to symptoms, I think we must actually look at people as a whole, holistic, looking at the social, cultural, and other heritages that people may actually have, and how mental health and well-being is actually framed within that context. Because it is only then that you can actually rightly understand how people might actually seek help for mental illness. So this is actually in a bottom-up approach, on a multi-level approach, embedded in a critical paradigm of decolonizing mental health and honoring cultural discourse norms and resources. Decolonizing mental health is actually widely proposed around the world, because obviously the colonial ways that we actually look at mental health systems and the whole health system. It is time that we look at things differently. It is time for a paradigm shift in which how we approach mental health and well-being of individuals, and how the community actually actively partakes in that actually approach, and in terms of how their voice and agency is actually heard in rebuilding those mental health services. That is actually paramount here. So the research goal here is actually identify the cultural patterns of urban and rural and indigenous communities, and how they shape the knowledge. Because it is important what they think about it. It is important what they actually like to see actually happen. It's also important to see how is it that they think about mental health, because mental health is not mental illness. And how is it that they actually look at mental health? And how is it that they actually look at mental illness? So, and the kind of help-seeking behaviors that they would like to see, and the perceptions and treatments. We need to kind of hear those narratives from those communities. And we want to then combine with an evaluation of the existing health systems and work with the ministry in reshaping some of those things. Not from the Western world, we're coming into trying to think about how systems should be in Guyana, but working with practitioners and researchers in Guyana so that we can mutually understand and identify those solutions. Next one, Nadia.
Apologize, I was on mute. Thank you, Raghu. Next couple of slides, I would like to talk about specifically the participatory research framework that we work in sort of consistently across a number of projects internationally, and we hope to work on kind of this project in Guyana in the future, as Raghu outlined at the start. So not to go into too much detail, but just to introduce kind of the philosophy of the participatory research. As Anu and Plateau say, that participation in research is a process in which ownership of the problem is increasingly shared between researchers and the researched. In the first instance, researchers are likely to own the problem and design the research using methods that enable stakeholders to express themselves, working directly with stakeholders, including communities, and gradually handing over this responsibility to them to set the research agenda will change the role of researchers to facilitators and turn the research process into a joint project. I took this quote because I think it describes quite comprehensively the ethos of participatory research. It's not just a methodology, it's very much a sort of a moral code or a philosophy with which you approach research process. You challenge the hierarchy that traditionally exists within the research process, where you as a researcher has the knowledge, the expertise, and you know the right thing to do, and challenges that insofar as giving space to listen and learn from the communities and the participants who have the lived experiences that you very much can learn from and should learn from. So it's kind of shifting a frame of mind in terms of how we approach research in general. So good participatory research, the way it should be done is a synergy between sort of the researchers' ways of seeing, doing, and knowing the world. This is what we do, isn't it? We ask research questions. You know, what causes burnout, for example, from the earlier presentations, what leads to suicide. We have our own perspectives in terms of what the key factors might be, how we should find out about it. You know, should we do lab studies? Should we do, you know, randomized control trials, those types of things. Who should we ask? Who are the experts? You know, those types of things. How much should they be involved? What part of their story should we listen to? So we kind of come with that set of understanding. But the important thing is that it needs to then layer over and with sort of the community's way of seeing, knowing the same thing. So if we are studying suicide, if we are trying to understand mental health, if we're trying to understand resilience, we need to go to communities and understand, well, what do you understand? What do you know? What is your experience? What would benefit you? How would you like to be involved? Not being prescriptive about it. And it's only when there's communication and there's kind of negotiation across that, between sort of the researchers' ways and the community's ways, that we have that research, theory, practice takes shape that has impact, that has influence, that is sustainable, but is also appropriate to those communities. When you actually come in with that intervention that you developed on the basis of that, it organically fits within the context that you developed it with, and the communities themselves. So if we think about kind of participatory approach as a kind of critique to the traditional way of doing research in some sense, where the power, the agency, the status lies with the researcher, and kind of challenging that a little bit, and not requesting communities to fit into these kind of institutional contexts. You know, we have this research hierarchy, we do have this expertise, we come from universities, you know, we come with that kind of sort of status that can be intimidating when you are initiating the research process. So being very much aware of that, and then balancing that with the participants' own dynamic way of being, their context, their layered understandings of their own reality, how relational they are across within the community, and not being kind of prescriptive there, and not instilling your own hierarchy onto that context. So challenging your own power in that sense. Providing voice as well, so managing voice in research. So who has the voice? How do you listen to your participants? Many times communities or people who we research with will be socialized into compliance to some extent. You know, I do a lot of work with children and young people. They're socialized into this hierarchy. I'm a young person, I'm a child, I have nothing to add. So it's about providing them space to share that. And communities, a lot of times, particularly within the medical field, you know, as patients, you know, they're looking to you for treatment, they're looking to you for care. Again, they're not really have that voice or agency within that context. Medical institution can be quite stifling in that sense. So practicing active listening within the research approach, balancing your researcher and participant perspectives. So as I said about the synergy earlier, looking at the contextual influences, you know, in terms of how culture, for example, might shape power, how might shape relational dynamics, what roles different genders play within that context, etc., would be very important to understand. So individual, social, cultural dynamics are all important to understanding kind of those layers. You know, it's individual, but it's also the community. It's also kind of the closer family members and friends groups. Also looking at sustainability of research. So participatory work is lengthy, it's laborious, but it's about kind of not tokenistic consultation, not a tokenistic questionnaire to a group of people, but also actively involving them. And it actually promotes sustainability of the topics that you're talking about, if there is trust in the relationships that you've built with those communities to perpetuate this topic further. That all leading kind of culminating in action, you know, action for change, as Raghu was saying, in terms of the systems, in terms of the processes. It will be very much a natural shift to that if you do that kind of participatory groundwork. So as solutions, we think around sort of the community co-design of mental health services for fostering that sustainability and social capital. So involving them from the beginning and involving them in the design process of what this should look like, what they would benefit on, what kind of resources they already have within their context, that change is not so foreign to them. Identifying community solutions to problems via opportunities for people to learn how others overcome mental health challenges. So it's about resources and knowledge that communities have that they can share with each other. So we can actually learn from that. We can share that with other communities as well. And supporting that community participation. And storytelling is one of the kind of ways in which participation can be promoted. And we'll give you some examples of that later with our work in storytelling and theater. And it's a very powerful method of bringing so the social cultural divides within communities to the surface, enabling their voice, giving them agency and giving them safe space to share that. We tell stories all the time. We tell stories of our lives. We connect with our neighbors, with our friends. It's a very natural way of communicating our reality and our perspectives. So eliciting those stories, sharing those stories gives ability people to recognize themselves. It connects to your identity, it connects to your history. And they become very, very powerful tools for change and for learning. So that's something that we do utilize quite a lot in this approach. So I'll pass that now to Raghu with one of the examples.
Thank you, Nadia. Right, so I think Nadia talked about kind of co-production, co-creation of knowledge, really. So research, in terms of mental health or any other forms of research should be transformatory. Transformation for the communities that we actually work with, and also transformation for the researchers themselves, because we are actually looking for mutual change here, both of this mutual learning and mutual change in terms of our own understanding as to how we see things, and also what kind of things might actually change in relation to the participants' perspective. So this is actually an example from a recent study that was completed in 2019. We completed this study looking at resilience of internal migrant communities in India. The migrant community we are looking at is the people who actually live in slums outskirts of Pune, a major city in Maharashtra in India. And sort of why we went for resilience is because of the fact that there is a lot of narrative around anxiety and depression and other kind of stuff amongst the slum dwelling communities. That is the easiest thing to do, because it is very easy to diagnose some of those things or some of those conditions. You give them a questionnaire or you take them to X number of places and then diagnose them. But how is it that they construct resilience in the midst of adversities? And how is it that they have they don't actually have a proper roof over their head, and in terms of there are issues in terms of poverty and also social issues, family issues, domestic violence, and number of issues that actually comes up. So how is it that they actually construct resilience in the midst of adversities and create mental health and well-being? So that is the story that we wanted to actually tell. So that involved in a kind of huge way of actually working with the community. So we worked with an NGO, and we worked over a period of 2 years with a small community, about 1,000 to 2,500 people. And that involved, we used a creative approach here. We used theater, we used drama, community theater as a methodology, not as a dissemination technique, but as a methodology of working with the community. And that because we felt that we could actually hear the stories of those communities in terms of resilience, and we could construct a piece of theater from that, and we could show that piece of theater to those communities, so that the community, the people, members of those communities, will be able to relive those migratory experiences from the towns and villages, and how is it that they've actually lived in terms of constructing this resilience over the last 10 years or so in their lives. And that involved a major shake-up of how we look at things, really, because it was an easy thing for us to actually go to a slum dwelling community and do the data collection. So our research assistants had to just hang out there for the first 2 or 3 months just to be there in that particular community and talk to people. And I think that's the way we actually kind of approach, so that there was no, they could talk to us, and they were not actually participants. And later on, when when they became so more familiar with those research systems, then they could then open up and talk about their own issues. And then we also used a number of engagement activities with the theatre partners that we have. We work with children, we work with mothers, we work with young women, and we work with some of the men in that community as well. So I think it's important how we actually then try and engage all those communities. It is that intention, that motivation, that will to change, that will to interact with those communities, that will to actually hear the stories. I think that is an example that we wish to try and tell in this particular research, really. So we think it is an untold story because it's an untold story of resilience, and this is actually funded by a UK Research Council, and I think this is they are very fond of this untold story narrative in terms of how we have actually used that particular technique. And we also have presented this particular project to the Overseas Development Committee in the House of Parliament in the UK as well. So let me just show you, I think hope the video works well. Let me just show you one of the engagement techniques that we actually use using theatre. Next slide. Okay, thank you.
Let's hope it works.
छोटी छोटी बातों को तुम हमसे आकर बतलाओ, हमसे ना तुम शर्माओ और बिल्कुल भी ना घबराओ। तो सुनो 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 तो सुनो सुनो ओ हो सुनो सुनो, बातों बातों से खेलेंगे मिलके हम सब गाएंगे। बातों से खेलेंगे मिलके हम सब गाएंगे, हाथों में कुछ रंग लेकर चित्र नए बनाएंगे, हाथों में कुछ रंग लेकर चित्र नए बनाएंगे। तो सुनो 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 तो सुनो सुनो ओ हो सुनो सुनो। हा ही हू करके हम नाटक दिखलाएंगे, हाथी कुत्ता बिल्ली मच्छर हम जानवर बन जाएंगे। तो सुनो 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 सुनो
तो क्या करोगे?
तो सुनो सुनो ओ हो सुनो सुनो, घर घर की कहानियों को हम दिलचस्प बनाकर, घर घर की कहानियों को हम दिलचस्प बनाकर, खेल खेल के माध्यम से हम आपका दिल बहलाएंगे, खेल खेल के माध्यम से हम आपका दिल बहलाएंगे। तो सुनो सुनो खेल खेल के माध्यम से हम आपका दिल बहलाएंगे। तो सुनो 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 तो सुनो सुनो ओ हो सुनो सुनो। कचरा जिसको कहते हैं आप उससे धुन बनाते हैं, बर्तन है ढोल लोहा ताशा और बाल्टी हमारा ड्रम, कहते हैं आप उससे धुन बनाते हैं, बर्तन है ढोल लोहा ताशा और बाल्टी हमारा ड्रम। बजा बजा कर नाचेंगे और आपको भी नचवाएंगे, बजा बजा कर नाचेंगे और आपको भी नचवाएंगे। दिन भर की वो टेंशन से हम हाँ 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 हाँ, दिन भर की वो टेंशन से हम आपको दूर ले जाएंगे, दिन भर की वो टेंशन से हम आपको दूर ले जाएंगे। ओ सुनो सुनो।
All right.
Right. So that was a snapshot.
Sorry.
We need to move to the next one.
There we go.
Yeah, thank you. That was a snapshot of the engagement activities that we conducted within the slum dwelling community. That particular music was actually done purely for the project by Rahman's crowd in southern India. So that actually helped us to actually engage with the communities and trying to be part and parcel of this community in terms of what they do. So some of the resilience outcomes from the research that we conducted looked at the kind of reasons for forced migration, what is actually that, and in how people are actually using their creativity, the resilience measures, and the resourcefulness that people may actually have in combating poverty, in combating fear, and also the kind of gender-based violence and other issues. And how someone's support systems and mechanisms still actually play a major role in terms of helping them to create that well-being. And also the kind of sheer drive for a hope for a better life is actually quite crucial in this context. So in terms of the local impact that we had as a result of this particular work, this is the community engagement and empowerment of those communities, working with some of the local policymakers, and we did a community play with the community, and also short plays, and actually a big play whereby the entire community could actually see this over a period of few days. And we also had a national conference in India, and also a conference in the UK, where we invited the entire research crowd to come and present in the UK as well. So it is actually kind of a balanced research in whereby we work together as a community of researchers with the population in terms of identifying the issues. So that is one example of how participatory model might actually work. Over to you.
Yes, I'll give you another example of using theatre as a methodology and as a way of engaging in sort of this process of co-creation and co-production. It's also based in India. It's focusing on mental health literacy, but this time in the south of India in Kerala, which is a wonderful, beautiful state. I had a pleasure of visiting on research trips, and yes, miss it very much. The objective for this project, it's still going on, by the way. We're kind of in the last year. We've had a bit of an extension as well in view of COVID to get some of the work done. We're responding to sort of the challenges within Kerala. It has this kind of Kerala model of development. It is, in terms of economical, kind of the social model, it's where other states are kind of looking up to and seeing, success of Kerala. But also it's underpinned by quite a significant increase in mental health problems. So with 14.4% of adult population experiencing mental ill health at least once in their life, quite high in terms of the suicide risk, especially compared to the rest of India. So we've conceptualized mental health literacy and promoting mental health literacy as a way of addressing that. So because it's a complex construct, it's a Western one. I very much appreciate that. We do address that in the study in terms of the knowledge and belief systems that people have around mental health. The kind of help-seeking behaviors that they feel are appropriate in terms of support for mental health. So would be going to see a psychologist, psychiatrist be culturally acceptable? Is going to see, an astrologer, for example, is relying on friends and family acceptable? Can you help somebody if you are not sort of qualified in that sense? As well as kind of generally protective factors. Do people know the things that can support your mental health on a day-to-day basis? So it's quite a holistic term. So it's trying to look at how do we incorporate it in promoting mental health literacy, particularly in terms of an intervention. But it has to be responsive to the cultural, economic, and social contexts. So we cannot just, again, come in and take this Western understanding of what is mental health literacy and just impose it in Kerala and think that that's going to make sense to everybody. It won't, but it has to be translated, it has to be transformed in the language, in the understanding that is accessible for the communities in Kerala, for different communities in Kerala, you know, understanding the rural, the urban context. And they're also affordable. So with interventions in low and middle income country contexts, you don't have a wish list. You don't have, you know, these fancy things that you can come in and implement. You have to deal with the resources on the ground that are both accessible and affordable in that context. So we've looked and used emancipatory research paradigm, where again, we've started with a participatory co-research methodology. We've worked closely with communities through the use of theater and storytelling, both for engagement, for connecting with the communities, much like in the resilience project that Raghu has mentioned, but also to collect data. And I'll give you a slide later to kind of shows you the kind of the interplay between, you know, these kind of engagement activities and also trying to conceptualize storytelling approaches as a way of collecting data. And we have connected directly with communities and individuals that are directly affected by this. So we work across 4 contexts in Kerala. Within each, we have a rural and an urban site. And we collected and involved both users of mental health services, their families and carers, as well as communities in general, to provide kind of a backdrop of cultural beliefs, norms, and idioms that have to do with mental health literacy. Because specifically, again, challenging that power and challenging that position of an expert that researchers can come in with, understanding that, you know, knowledge and, you know, help seeking resides within the users, you know, the people who have those lived experiences of having mental health problems, for example, in that context. How was it for them? What did they go through? Who supported them? How did they conceptualize it? Again, giving space to and giving time to hear their stories, learn from them, because they're usually overwritten, and kind of magnifying those experiences in order to reconstruct their kind of knowledge and ability in a process of understanding and empowerment. So challenging kind of, again, the hierarchy and dynamic, and amplifying, kind of reconstructing what we know about mental health literacy from their perspective. So up comes quite a complex slide. We're still trying to conceptualize of how to present the complexity of the project in the most succinct way. So this was one of the first attempts to do this, so bear with me. So as I said, we've used both mixed and creative methodologies in this project. So we're interested to collect data, to do the kind of academic stuff, to collect evidence, as well as engage and utilize these participatory methods throughout this project. So it was quite a lengthy process. So we've started with storytelling. We've collected narrative interviews from, as I said, 4 regions in Kerala, from users, carers, and community members. So these were interviews that were collected in these areas, quite an extensive number of interviews. So our researchers have spent time in those communities for a long time to build rapport. They worked with our NGO partners who have history and rapport with those communities as well. Worked with link workers and health workers there to connect and to learn about the context that they were collecting data in, which then led to the development of clinic plays. So I'll show you a clip in a little bit about kind of co-creating with our theater partners and actors some of the narratives that we received from the first part of data collection, to again replay and retell those stories to the communities where we gathered them. So quite anonymized, you know, it's told as a story, but people can connect to it. which then led to and informed our adaptation of a measure of mental health literacy. So we've created sort of a derived ETIC. We've derived a construct of mental health literacy that is native to Kerala, to the language and to the notions and the cultural beliefs around mental health. When the COVID hit, we've also hosted a film festival when we had about 70 film submissions, where individuals reflected on mental health and mental health literacy. From the storytelling, the initial interviews that are kind of driving some of the data and the initial clinic plays, we're now developing a larger sort of theater play to be again taken to those communities as a form of intervention and promoting better mental health literacy. And then working individually with certain individuals, certain narratives to develop digital stories, individual sort of fragments of experience that can be shared digitally, and again, give them space to tell their stories in a more focused way. And we're using the measure that we've adapted throughout these activities to again administer and collect data on mental health literacy in the region. So you can see kind of the different areas of the methodology really informing each other. So again, this is a short clip on how the clinic plays have gone in Kerala. So this is the clinic plays that were done following the narrative interviews. So we've had a number of these clinic plays across the research sites, and they were very, very useful, both to continue engaging with the communities that we've collected narratives from and play those narratives back to them. They had space within those clinic plays to comment, to get engaged, to alter the narratives. So that, again, those themes of agency and action, coming through in this kind of co-creative approach. And again, it offered us as researchers insight into our analysis. We've used some field notes, we've used the comments that the audience had. So the audience were our users, community members, and carers, to further our analysis of narratives, to support the development of the intervention along the themes that are prominent within those communities. So we are kind of hitting what's important to them and listen to them. So able to focus our intervention on that. And again, continuation of this dialogue. It's not about kind of research coming in and coming out with the data, but it's about that continuous conversation as we're learning from each other about this process. So they have been very, very fruitful, both as an engagement mechanism and as a tool of data collection. So it's conscious of time, Raghu, that's for you to close up.
So some of the concluding thoughts in relation to this, because I think we set off a journey in relation to exploring how we can actually transform mental health services with a systematic change. And that's what we aimed to actually do. And we developed a proposal in relation to how this could actually happen. So from the concluding thoughts, I think in terms of the plan for any service change, the research should be for community change. And I think it should actually look at community, individual and community empowerment, and how it might actually shape up the policy and the services of the future. I think we should try and look at, not rather than compartmentalizing the whole research process, and I think we should look at the whole system approach as to how that might actually function. And I think gone are the days. I think it's important that we move a paradigm shift towards an inclusive approach, whereby systematic reviews and RCTs have serious limitations. And I think it's important that we actually talk to people, we engage with people, we hear their stories, and we see how services should be developed from their own perspective, not from a professional perspective, not from a service commissioner perspective, not from a governmental perspective. But I think is using the community participation and mental health as a strength-based model, because the individuals have thoughts, they have wishes, they have aspirations, and they have strengths. And how we actually tap that, those resources, those valuable resources in terms of community participation and change for services. And I think it's important of culture and cultural heritage in attitudes and feelings and behaviors. They are linked to mental health and help seeking. So I think it's important that we actually focus on culture and cultural heritage, which provides immense knowledge and help and resources for communities to address some of those issues by themselves, and also how policymakers need to actually take account of all those issues in terms of research and service development. Thank you for your attention.